Good morning, welcome. I've got Eleni Ottalagana here today, and she's an RD out of Austin, Texas, and she's going to talk to us about women's health and PCOS, Polycystic Ovarian Syndrome. Hi, Eleni. Thanks for coming today.
Yeah, thank you so much for having me. It's great to be here.
I'm really excited to talk about this. So before I go into more introduction, some of you might be wondering, why are you talking about polycystic ovarian syndrome, PCOS, as a nutritionist? Most people would think this is an OBGYN thing. This is a women's hormone reproductive issue. But I think what you're going to hear is that it actually is very tightly linked to metabolic health. I know a fair bit about PCOS, but I recently heard Eleni in another interview with Leslie Vitel, and I learned a lot of new things that updated my knowledge about this. So if you have PCOS, if you suspect it, or you know somebody with this, I really want you to listen to this and share her information with them, because I'm really going to see how much I can learn from her today, and hopefully she can shed some light on this. And I think the important part is, when you take it out of the OBGYN category and put it in the metabolic health and nutrition category, I think what Eleni's going to talk about are the things that you can do, the things that are on your side of the street to help you feel better. Yeah. So Eleni is a registered dietitian and a Reiki Master. She owns her private practice is the Women's Nutrition Clinic out of Austin, but she does telehealth. She, like so many of us, if you have the internet in the English speaking world, she's your person for women's health and PCOS. So she supports women's lifestyle changes using holistic, integrative, and functional nutrition approaches. So I'm actually really interested in a bit about your background. Would you mind talking about your background, because you have polycystic ovarian syndrome, don't you?
Yes. Yeah. So I like to say I fully reversed it. And I know that can feel kind of sensitive, like for women that have it and who have been told like, this isn't reversible, you'll have this the rest of your life. However, when we use proper nutrition and lifestyle strategies, a lot of us can reverse the symptoms. However, that does mean we do have to lead a healthy lifestyle, right? It's like, if we start getting off track again, the symptoms can come back, right? So that's the beauty of nutrition and lifestyles, is consistency can keep us in a really resilient place. So growing up, I was always, fairly healthy, grew up in a really healthy household. My mom was actually into like herbalism and worked at an apothecary on weekends, which is kind of like an herbal shop for a lot of people that don't know. You get a lot of natural remedies there. So I always viewed health from, we don't start with medication, we actually start with herbs and foods. And so this is kind of, I guess, important for the story. And then as I got a little bit older, I was diagnosed with PCOS. So like my late teens, I started seeing a lot of excess hair growth, which was, I'm Italian and Greek. So everybody and my doctors was like, no, it's just normal. You're at that age. And I said, no, this is weird. I'm like waking up with excess hair growth. I had started seeing some changes in my menstrual cycle. And so I was really my own advocate to ask the doctor, like, run these labs, because I think I have this PCOS thing that I had discovered. And sure enough, I met the diagnosis criteria, and they diagnosed me with PCOS, and then they wanted to put me on all these medications. And they also noticed some thyroid stuff going on, and thyroid conditions and PCOS can be tightly related. So I was on metformin, birth control, thyroid medication, anxiety medicine, and one more I can't even think of. But it was just crazy. I'm like, why am I taking all these these medications? I felt awful. My gut was terrible from the metformin and birth control. Tons of worse anxiety, worse depression. My blood sugar, insulin were not good, not within normal range. And I just
before the medications or after the medications?
Before and during. Things weren't really changing much. So I said, you know what, this route isn't really working. I was actually at that point in college. So I'm already going on a couple years with medication, trying to figure out PCOS, and I'm in school for nutrition because I love food. I love the real food movement. I love sustainability. And I said, wait a second, I have all this knowledge. I also grew up in a holistic household. Why don't I try this route? So that's where I largely depended on nutrition and lifestyle changes to heal my body. And I did bring in some specific herbal supplements as well. And, you know, after a long road with not a lot of direction, because PCOS wasn't as, I guess, like popular at that point, we didn't have a lot of understanding. I was able to fully reverse the symptoms. And now I can still lead a really healthy life, right? And make sure that my labs are good. So kind of a long answer, but I understand PCOS. Like I get it, what these women are dealing with.
So yeah, it was a long answer. Unfortunately, it wasn't a long enough answer. So let me ask you some more questions. Yeah. So when you work with women in your practice, do you see other women coming in also on a lot of the same medications that you were on?
Yes. And I think it's, you know, it's really frustrating that, you know, 15 years later, it's like we're still using the same treatment protocol, which is essentially just masking symptoms. We're not necessarily getting to the root imbalance or the root causes. And that's why I'm so passionate about nutrition and lifestyle changes. Medications aren't bad. Sometimes we need that support, but if we're not doing the foundational stuff, like changing what we're eating, changing our sleeping habits, changing our stress levels, it's really hard to see that change. So yes, I often see women on metformin and birth control. Those are the two common. And then also spironolactone. That was that last medication I was also on.
So when you talk about root causes, I remember when I first started learning about PCOS back in maybe it was the early 2000s, when I was learning more about metabolic health and getting my practice started. And I was under the impression that a root cause was insulin resistance. And I remembered reading, you know, even if you just start moving the needle on weight with women with PCOS, that can improve things and be a root cause. But I've heard you say different things. So could you talk a little bit about root causes with PCOS?
Yes. And I think this is kind of like a newer concept that there can be these multiple root causes. So insulin resistance, I think is definitely the most common. Well, what's causing insulin resistance in these women, right? Which is something very similar if we have something like type 2 diabetes. So we're seeing a very processed diet, right? Lots of carbs, lots of excess sugar in the diet, not a good balance at mealtime. So a lot of these women are coming in with this insulin resistant state. And that insulin can cause the ovaries to produce more testosterone. And that's where we're starting to see this hormonal imbalance. So people are starting to say, oh, this is a reproductive syndrome, right? Or we think, let me go to my gyno because my period's off. I'm not getting pregnant, when really a lot of it's metabolic. It's that insulin. It's what we're eating. So that's one root cause. Again, I think that's definitely the most common, what I see the most as well. And then we have a few others. So inflammation can definitely be a root cause. So if there's inflammation in the gut or there's some other autoimmune condition going on, that can cause some sort of stress and then create this sort of metabolic and hormonal cascade or shift in the body. Another is actually birth control. So some women are put on birth control to help regulate the cycle, right? If they have PCOS, it's like, let me take the pill. We're going to get this menstrual cycle on track. If you had normal periods before taking birth control, and you might have gone on it for other reasons, which is totally fine, right? That happens a lot. But then when you get off the pill, you get diagnosed with PCOS. It means that the pill was likely the root cause.
Oh, so hold on. You could have had irregular periods.
Yes.
Already.
Regular periods before.
You could have regular periods before. Gone on birth control periods for whatever reason, like not to get pregnant. And then how can oral contraceptives cause it?
Well, it's completely shutting down that communication from your brain to your reproductive system, right? So now women aren't getting a period for 3, 6, 9 months, a year. I see women that don't get their periods for up to a couple years because
after going off birth control.
Yeah, because they've been on the pill for maybe 10 to 15 years. So it's completely shutting down that communication. And we can also have something called this androgen rebound when we get off the pill. So testosterone skyrockets, is trying to get back in control because the pill naturally decreases testosterone. And then some of the estrogen or the progesterones that are used in the pill can create some metabolic distress. So we can actually see changes in blood sugar and even insulin. Everybody's a little bit different. Some women get off the pill and in 3 months they're normal. But a lot of women I see in my practice as well is they're getting diagnosed with PCOS, which is so like emotionally heartbreaking, when a lot of times it's, you know what, you've been on this medication for so long. We just have to give your body time and grace and the right tools to get back on track and really get back online. Like we just got to start talking to each other again, the body systems.
Can I pause and
yes,
pin that a little bit? I know that you have some experience using herbs and you're an integrative practitioner. So let's go back to PCOS in just a minute, but I want to capitalize on this. When people are coming off of birth control pills, are there ways that they can support themselves to get back on track and improve that communication?
Absolutely. And, I think a lot of this is really individualized, right? So I think this is where you definitely want to find an integrative practitioner who can run specific lab tests with you to see where your system is at. You usually don't even want to test anything until you've been off the pill for about 3 months. That's going to give you a more accurate picture of your baseline, and just some standard herbs that I would say definitely, see a provider to do this, but some that I really like are Vitex. That can be a really nice one that can help, especially with progesterone levels. I love vitamin B6. I love vitamin C. These can also be really supportive. We might need to do a little bit of adrenal support as well to get things balanced again. And if the testosterone's starting to skyrocket, we might want to, again, look at the root cause, but bring that back down so women aren't suffering from symptoms. So I like saw palmetto. I love doing gut support. So some good probiotics after getting off the pill, and a really nice multivitamin or B complex, because the pill can deplete some major minerals and vitamins. So
it can.
My favorites.
And you talked about testing, and I think that's so. I remember when I first started practicing, some of these tests, like I assume either you'll have doctors run it on insurance, but often do you use a Dutch test?
That's and that's what I advocate for clients too, because we're not getting a super accurate picture for doing blood tests, especially if we're not timing it. We really want to take these tests at a certain time of the month, and if your cycle is irregular, then we have to get even more detailed and keep that in mind. So I would advocate for any female, if you're doing hormone testing, find a practitioner who will run the Dutch with you.
Yeah. And I like I was saying, sometimes I always thought, oh, it's so expensive. But, I've personally, anybody who's had a health issue, and so many of us have, we know what a bill you can run up with supplements that might not even work. I mean, really, you can easily hit $300 in a month or two with supplements, less than a month if you're on a lot. And, a lot of these tests, like a Dutch, can run $300-400. It's actually amazing. It can save you money, and more importantly, actually help something work so much better when you can target these hormones.
Yeah, and I'm so glad you brought up the supplement conversation, because I think it's easy to take a bunch, see something online, and think that's going to work for me. And I always say, we want to do what's most appropriate at this time, and then maybe change and switch things out. Like, you never want to overload your body. It takes energy to absorb these supplements too. So you also don't want to overload your body. So yes, very important to be super precise. And when we are precise, I see amazing results with clients. I've had one client with PCOS. She got off the pill. Her doctor said she would need probably like IVF, thousands of dollars of treatment. We ran the Dutch with her, and within 4 months of working together, she was pregnant. Now, that's not everybody's story, but how beautiful that it was. Like, oh my God, we figured it out right away. And she showed up. She did the work too. She did all the nutrition, all the lifestyle.
Would you feel comfortable kind of walking us through her process to hear how that worked for her?
Yeah. And I think it's, very like standard process for many women, and maybe even women listening to this will just feel like comfortable, and it lifts a weight saying like, I'm not the only one going through this. So something I see a lot is, I was 13 or 14, started my cycle, and it was irregular, and then for some girls, it's like I started gaining weight and we're not really sure why. So they're also told to be put on a diet, which causes this own emotional response and triggers this, I think, kind of sad relationship with food over time. And so very similar with her too, like cycle was irregular, put her on birth control. So then she's just on birth control for years, because that's what she was told to do. Then early 20s through college, it kind of makes sense to be on the pill too. And then, mid to late 20s, ready to come off, high functioning female, really busy at work. So a lot of stress too. And she told me, she's like, I'm, stopping this birth control pill. Pregnancy is my goal, while I also have this PCOS diagnosis. So we first started with what I would say the foundations. So we are looking at what she's eating every day. So trying to find blood sugar balancing meals. So meals that are going to support her, give her energy, fuel. We also supported her gut, because women with PCOS are more likely to have an imbalance of bacteria in their gut microbiome. So we did
really?
Yeah. Fascinating. So we did some specific supplementation, like some good probiotics, but we also brought in tons of fiber, resistant starch foods, which act like prebiotics. So they go ahead and feed the good, healthy bacteria that we're repopulating her gut with. And then we did a lot of stress management. So we cut out coffee, because that was causing way too much of a cortisol and blood sugar issue for her.
Oh my God, we just lost half our listeners when you said cut out coffee. I'm just kidding.
Yeah, I know. For her, we cut it out. I don't tell everybody to stop. I just say, how do you feel? What are our labs looking like? Some women, I always say, have it later in the morning. For her, she felt better, so we didn't do coffee. We got her outside getting natural sunlight exposure, because natural light exposure is so important for hormone regulation. And we are behind these fake screens all day long. And then we got her moving her body in a way that was supportive and not depleting. I find that a lot of these women with PCOS, they want to hit the gym and work out super hard, but that can actually be more stressful and make it even harder to get the hormones regulated. So I hope that makes sense. Kind of a long-winded answer, but that was her process. A lot of
those aren't like really highfalutin like concepts. You're really hitting the basics.
Yes, we are. And we're hitting the basics with consistency and accountability. Because again, I think there's so much noise out there of like what we should be doing to be healthy. And it's sad. And I see a lot of disordered relationships with food because of a lot of fad diets. And while certain diets and protocols can be beneficial, it's really the foundations and the basics and consistency.
Oh, I think you're so right. I mean, I don't know how you feel about this, but
yeah.
If I'm paying attention, I get confused. And sometimes I think, oh, are you doing that? They're using all these things. Should I be doing all those things?
Yes.
And if I'm getting, squirrel brain over all of it, everybody else must too. But I think just having someone like you who's been through it, who's and then professionally, academically is an expert in the field, showing, giving weight and value to these, circadian rhythm, light exposure, balancing blood sugar, reducing stress. I mean, those are just, advanced adulting skills in a way, but just because they're basic doesn't mean they're not really key.
Yes. And I love that we're on the same page, because something else that comes to mind is like the modern day female is under so much stress, like working full time, and the modern day male is too, right? That's why we're seeing a lot of these infertility issues. So I think it's sexy to take this like complicated protocol, lab test, and supplement mixture. Like that's the sexy thing to do. But your body is so depleted from the foundations. And that's what I'm just so passionate about this, because I think as a society, we kind of need to wake up to this concept of like, we need to connect more with Earth. We need to indulge in sleep and dream state. We need to breathe, and we need to eat our meals away from electronics, because this body, that's what it's asking for. Like to function on this earth, that's what this physical body needs. So, yeah.
That's really good.
Mm-hmm.
Yeah. It's hard to sell a book about those boring things these days.
I know. Yes. Fortunately, I don't want to write a book anytime soon.
So I probably should have done this in advance. I apologize. I get excited about, I know I'm doing an interview for other people and other, people who might have this, but of course you've just indulged me in my own, I want to ask the questions. So can we back up and talk a little bit about how do people know they have polycystic ovarian syndrome? What are the lab tests, and what's the phenotype as well?
Yes. So, great question. So, in order to be officially diagnosed with PCOS, you have to meet 2 out of the 3 diagnostic criteria. So, this could be androgen excess, polycystic ovaries. So, meaning they're doing an ultrasound, they're literally seeing what they call like these string of pearls, like all these little cysts on your ovaries. And then menstrual imbalances or menstrual irregularities. So, not getting a menstrual cycle, 28 to 35 days, you could be going long periods without it or really heavy. So again, you have to meet 2 out of the 3. So when women are diagnosed, some women don't have the cysts, some do. But typically women aren't saying, I really want this test. Tell me I have cysts on my ovaries. They're usually noticing symptoms, and that's driving them to the doctor. So I think what's going to help our listeners more is, identifying if you have this or one of your loved ones does have or has any of these symptoms. So excess facial hair growth or on the chest, nipples, back. So really any hormonal area of the body, it might be more than what would be considered normal. We're also seeing like cystic acne. So that's hormonally driven as well, especially around the jawline, hair loss as well. So kind of like around this crown area, like what male pattern baldness. So very similar to that. And then we might be seeing excessive weight gain. So even if you're feeling like I'm eating pretty healthy, I'm exercising, I'm not losing weight, I'm super hungry, I'm super fatigued, these can all fall within that insulin resistance state. So those are common symptoms.
And is that weight also follow the pattern of that apple-shaped weight?
Yes.
Abdominal
Yeah.
body
So
fat?
abdominal weight, bringing more central adiposity. I don't know if I said that word right.
Yeah.
And then the changes in menstrual cycle, like I said. So some females say I go like 6 to 9 months without a period, or I get them every couple of weeks and they're super heavy. They're just off. So those are the symptoms more in detail. So if you have any of those, go to your doctor. I think the diagnosis is important because then it can allow you to figure out what is the next step. Whenever women come to me, I say, thank God you got the diagnosis, because those 4 little letters are just telling us your body's asking for help. That's all these symptoms are. I never want anybody to attach to the diagnosis, but that diagnosis is what's allowing you to be here and do the work that's actually going to give you change.
Right. And so so they got the diagnosis, and that's a good thing. So they know kind of generally what's going on. And so what's their next step? Obviously their doctor's because their doctor's going to use what's in their toolbox, which is, like you said, metformin, maybe birth control pills. Should they try those first? Is there a value in trying those first? Is it okay for them to say, let's just set those aside for 2 or 3 months and try something else more natural?
Yeah, great question. So I do find that a lot of doctors, or what I'm told by patients, is they'll tell the client to do a low carb diet too. So while a low glycemic and balanced approach to eating is beneficial for anybody under the sun, I think when you label it this low carb, don't eat this, don't eat that, it gets really challenging. So, and if anybody wants to take a medication, I'm always supportive of my clients. I'm never going to tell you not to take something. You have to do what's right for you in that season of life. If you are so numb by the symptoms, like if these symptoms are keeping you from showing up in your day-to-day life, you might need some medication while bringing in the foundation. So I never want to say do one over the other. But if somebody's like, I really don't want to take medications, maybe I've done them before, it just doesn't align with my values, there are absolutely holistic approaches that you can take instead of doing the medication if you prefer that. So there's a supplement, inositol, for example. We have studies on that. It works just like metformin to support insulin and blood sugar. There's things we can do to balance hormones. And of course, we have to be doing nutrition and lifestyle and being like, well, why is your body out of balance in the first place? It's not because you have a deficiency in metformin or even, a deficiency in this herb. It's probably because there's something off in your life.
Gotcha. So it's not an either or. You can use one and then the other, or some combination.
Yeah, I think it comes down to a person, right? Like what is going to help you? But I always like to educate my clients about, if you're on this medication, then we need to do gut support. We need you on a multivitamin. We need you on a B12, because your body's getting depleted if you're on this. So, and if that still aligns with their values, awesome. Let's do that, because I just want you to function and enjoy your life more too.
Right.
So
you help support the medication working, so that so better life through pharmacy, not worse life through pharmacy.
Yes.
Yeah, that's key. I think that's really important. I notice a lot of people will come to me and I hear the tone in their voice when they're like, oh yeah, I'm taking this medication, as if you can't do both.
Yeah. Yes. I'm so glad you brought that up, because I think judgment and shame comes up a lot. And it's not like one way is the right way and everybody else is wrong. And that's what integrative care is. It's integrating the Eastern and Western world and integrating all of this and finding its place. So I always come from a non-judgmental place and just be like, just tell me, like, this is your journey. I'm just your guide. So whatever information you need, I'm going to do my best to just give it to you, you know?
Yeah. And also, like you said in the beginning, a lot of these are women who are under a lot of stress.
Yeah.
Not necessarily bad stress either. They're driven, successful. They might have a career that's demanding, that's fulfilling, and they have a family that's demanding and fulfilling. And not all of us can or want to quit our jobs, offload our children to somebody else. There's a time. It's not the season to just stop and take a 4-month retreat and just
Like, as nice as it would be to run away to a mountaintop, even myself, like that sounds amazing, to drop everything, but we can't, and we all have purpose in life. And my goal is to help people create a resilient baseline. And that's what I tell clients all the time. We're just here to create more resiliency so that your body isn't breaking down, but to also identify when too much is too much. What are the boundaries, that you need? But I love that you brought that up.
Yeah, for sure. And we've all been there.
Yeah.
So I'm actually interested in your program, because I know you work with people one-on-one. Like, people will come to you, like you were talking about this woman who came, and then 3 months later or something, she got pregnant, and she didn't need the IVF. But do you also do do you do any other programs and group work, and how do you support people?
Yeah. So the one-on-one, it's usually like a 3 to 4 month starting point, because a lot of women find success in that. If we're consistent with nutrition and lifestyle changes, and we're shifting our mindset, and we're repleting the body, we see success. So a lot of this is, meeting every other week. They have access to an online app. They get summary materials, etc. And then I started creating group programs, because I said, wait a second, I'm having these conversations one-on-one, and a lot of these women are feeling super alone, really frustrated with their symptoms, lack of community. So I had this aha moment of like, well, a lot of the foundational education, we're talking about the same things with some differences in some individual experience. I said, well, what if we create this group so that they're getting the foundational information all together? They can support each other, while they're still getting some one-on-one care. So in my groups, they still have one-on-one calls with just me. So if there is something they need to deep dive into, like a supplement or a lab or whatever, we do that. So the group is also about 3 months long, going over, all the educational pieces, nutrition, lifestyle changes. Because I approach PCOS holistically, we look at different body systems. What can we do for our gut health, our thyroid health, our adrenals, etc.
Right.
Then they get access to this app in between their sessions as well, to communicate with the community or to communicate with myself. So it's been so fun. I love bringing the community together, and it's like, you're not alone. See, if I had that 15 years ago, I honestly think I would have healed faster. I felt so alone and embarrassed because none of my friends had this.
Right. That kind of community care, community support is so important. And we, people in business, like we know, a lot of times we do group programs because it allows us to provide services at a lower price.
That too. Yeah.
Because when you're like, well, I can be serving 15 people in the same amount of time as I can serve one. So I can reduce the price, and it makes it more accessible. But I think but there's actually benefits to people, and that is that group interaction. Because I know when I've been a participant in group programs, sometimes half the benefit is the other people that I connect with.
Yeah. And listening to their stories too.
Oh my gosh.
You can learn so much. I've had another group, it's been going on for 2.5 years now. And so this is for anybody who finishes the one-on-one, or even when they're done with their group, but they still want to meet just once a month. And I've had women in that group for 2 years, a year and a half, 8 months, like they all stay because it's this connection and we're always learning. We never stop learning and changing. Right. So yeah, that's really what sparked me. And then it was, wow, this is actually an entry point for clients to get really good quality integrative care at, an affordable price, which is sometimes hard to find too. Functional medicine and integrative care isn't always covered by insurance. Right.
Right.
Yeah.
And the other thing is, I mean, yeah, you're always learning and there could be new things, but I can't be alone in this. Even though you know what to do, like, here's all the things I know what to do. Great. I'm fixed. I'll do these consistently forever without failure. That says no one ever.
Says no one ever. Yeah.
Because people get sick, something happens. Sometimes there's a pandemic. Some things throw us off our game. Sometimes if we don't have those positive voices reinforcing healthy choices, reminding us that it's of value, that we're of value, those things really help support those choices.
Yeah. Yeah. It's so much is mindset, right? And that was even important for me in my journey as a dietitian, going back to school and doing a really in-depth program on how to be a better coach too, because that's important. We can't just deliver facts and protocols.
Right. So you've done coaching. Are you a coach as well?
I'm not through an official certified coaching program, but I did a first level program. It was about a 6-month course, just so I could further support. And we got some coaching, being a dietitian in college. So it just kind of reinforced that of we have to ask the right questions and know how to provide support and not just be a robot. And that is something I think, I hope that I provide value. And I think what my clients see is valuable of okay, I'm getting education, but then I'm really getting this support and work through barriers too.
Right. No, you're absolutely right. Because in our initial training, we are trained to just deliver.
Yes. Yeah.
Oh, what else do I want to ask? I wonder if there's any questions about this.
I guess
comments about the coffee. I know that was coming in. That was the first thing I learned in diet therapy. The person who got up in the chalkboard in graduate school just wrote on the chalkboard, "Don't take away the coffee." But of course, "Don't take away the coffee" refers to when someone finds themselves in the hospital in some kind of acute care situation and they wake up and then you take away their coffee, you're going to have a revolt on your hands.
Yeah.
When you're in a coaching program and you're talking about it and it's you're talking about what's helpful, what's not helpful. That's very different.
And one thing, about coffee too, is even just having it with your breakfast or late morning, once your blood sugar's already stabilized from protein at breakfast, I find women feel so much better. They're like, wait, why was I having it first thing in the morning? I was jittery and didn't even feel good. So it's easier to stick to it if you feel better, once you change it.
I find that too. So one of the reasons I had you on is because I specialize in metabolic health. And a lot of what I do is I'll use continuous glucose monitors in groups. And what we find isn't so much that you have to completely eliminate something.
Yes.
It's understanding how it works in your body so you can be strategic. Again, kind of like if you're going to use medication, let's make that medication work for you instead of against you. So if you want that coffee to make your life better, let's face it, we want the coffee to make our day better.
Yes.
So instead of having it first thing on an empty stomach or it makes you jittery and messes up your appetite cues, you're having it after your meal. So it actually helps you wake up, digest your food better.
Yes. Yeah. And like I said, we want it to make our day better. And I always like to say it should be an experience, right? While it's giving you energy and focus, there can be this ritual and actually just enjoying the taste. So try to use nourishment to fuel you and then invite the coffee into your day. And I think that even speaks to a lot of the philosophy of balance is okay. Yes, sugar's not ideal, but a little tiny piece of birthday cake for the experience, or even a few bites. I use something called taste eating with clients. Just take a few bites and acknowledge it and acknowledge the people around you. And they often say, "I'm done. That's all I needed." Right. And have that after your meal when your blood sugar has already been balanced from the protein. So this is a whole other topic we could get into, but I think that's what it sounds like you're seeing in your groups is oh, we actually don't have to be super restrictive.
We just have to have a little protein first.
Yes. Protein. Yeah.
Yes. It solves so many things. It really does.
Yeah.
Yeah. Um, let's see. Genetics.
Mm-hmm.
Now this was something that I heard you talk about a while ago that was new to me,
Mm-hmm.
that there was a genetic component to this that I didn't know.
Mm-hmm. Yeah. So there, we could think of like epigenetics, right? So your family might have this chronic disease and you might think, I'm destined to get Parkinson's or Alzheimer's, right? But your environment largely drives if these genetics even get turned on. So if we can control our environment, we can oftentimes control how the gene is expressed. So I preface with that and saying that there is a genetic predisposition to PCOS. Well, why are we seeing all these cases now? Perhaps it's because our environment is more toxic and the foods are more processed. So I think what I've seen in the studies is like they're still nailing down the very specifics as to how it's expressed. But what we're seeing is there is this genetic component to PCOS. And so there's probably somebody on your mom's side or your dad's side that has it, had it, or maybe it was never fully expressed because our lifestyles were healthier. Back in the day. So I always tell clients, it's like, for whatever reason, your gene got flipped on. It's just like if you flip the light switch on. So now we have to go back and figure out from an environmental perspective of how we can kind of calm that response down.
That makes sense.
Yeah.
That makes sense. And we just do live in a very, I heard that someone in a different realm talk about we have a very obesogenic climate.
Yeah.
And they were this was about an obesity study and how about half of us have genetics where we're prone to obesity. We're prone to kind of flipping that survival switch. But that wasn't showing up before, but because our food culture, our culture is so obesogenic, our food culture is one that does tend to promote like insulin resistance.
Yes.
And inflammation, which also feeds insulin resistance.
Yes.
So maybe that's why we're seeing it so much more. And it makes sense. Like you said, when you were in college and you were first coming around to it, there wasn't all the support and knowledge around it.
Mm-hmm.
But of course, now that we have, well over 30% of our population with insulin resistance pre-diabetes.
Yes.
And if that's going to be kind of switching on the phenotype for polycystic ovarian syndrome, then we're going to see a lot more people with PCOS.
Yes. And the work you and I do, while it's different, it's so similar because, at the core, most of PCOS is this insulin resistance, right? This pre-diabetic picture. And so if, as like a society, if we just shifted this, I really think these rates of PCOS and infertility would not be where they are today.
Right. Yeah. And so just speculating, maybe you have some data on this, but speculating, how much do you see is stress, like stress and circadian rhythm, and how much do you see is diet?
I love that you said that. I almost feel, I guess from my clinical practice, it's almost like half and half because this other root cause we didn't get to just yet, this is a perfect segue, is a lot of women they're not overweight. They're like very type A, slim, busy bee, and their adrenals are responding by producing excess testosterone. Their bodies are so stressed out, they're not getting a menstrual cycle. So then it's like, oh, you have PCOS. And really what I've seen in trends in my clinic is we have more of this like insulin resistance picture. And then this female that's getting diagnosed and they're just really stressed and they're really high functioning, which is awesome. They're achieving a lot, but they're putting a lot of pressure on their body and their system. And they're probably even under eating unintentionally, often like drinking coffee and eating a pastry. And then I go all day. So I love that you asked that because I think it's half and half. And I think we're like also throwing around the word PCOS way too much when it's like, you don't have this, this is going on. And I kind of like being that person of like, again, don't attach to the label. Let's just address what's going on.
Yeah. So these are women who don't fit that overweight.
Yeah.
Insulin resistance. And you see it. So the stress and the under eating.
Yes.
Is causing so they might not even have cysts on their ovaries, which is not necessarily part of the diagnosis.
Doesn't have to be. They don't have to have it.
They might just have lower levels of estrogen, progesterone, and or higher levels of androgens like
Yes.
testosterone.
Yes. Yes, I see that.
And they might still get the hormonal acne.
Yep. Or a little excess hair growth because their
Mhm.
testosterone's higher. They're stressed. Their body's stressed. They're kind of in survival mode.
That's really interesting. And
Mhm.
oh, can we just go slightly off topic and a little more of that?
Yeah.
Okay, now I'm asking for a consult on a Dutch test that I just got from somebody. I've seen people with very high levels of stress, women with very high levels of DHEA, really high levels of DHEA and testosterone, and high levels of cortisol. And do you see that as oftentimes the stress component?
Oh yeah, yeah. Because then we'll say, they're coming in with symptoms and they're saying we're stressed. But then if we actually look at a test, it sort of validates and brings more value behind why we want to make lifestyle changes.
Mm-hmm.
Yeah. So I often see that. Super often.
Okay. Yeah, that makes a lot of sense.
Mm-hmm. And I love tying it back to this fact of like, and a lot of women are coming because they want to be pregnant, right? And then they're getting labeled with PCOS. And I just think it makes me sad to see like where we've come in society in some ways of like why we're feeling so stressed and pressured. Like I'm victim to this too. Like I get stressed, but life is supposed to be joyful and abundant. And I just want to help women realize that like, okay, your body's stressed. We can see this. So what needs to shift?
Yeah. I think one of the last things I want to ask really is when I first learned about polycystic ovarian syndrome, and I know there's a metabolic part where, okay, there's insulin resistance. And of course that puts you at risk for heart disease. But is there ever, how am I trying to phrase this? Is there ever a PCOS where, like, how much of it is a health issue and how much of it is, not that it's lacking in value, aesthetics? Because there is a big aesthetic component to PCOS with hair loss or just hair where you don't want it and not enough hair where you do want it and weight gain. There's a big aesthetic component, but is a big part of it also long-term health?
100%. Absolutely. And, that's one thing I even try to educate my clients on is because they're not even aware that if they don't get this thing under control, that it does put us at higher risk for other chronic diseases. They're not often told that. Usually it's like, well, you might have issues getting pregnant and you just want to lose weight maybe because of diabetes. So I really try to say, it's important. I want you to feel confident in your body, but the symptom is also telling us something. Right. So I'm glad you brought that up. Yeah. Because it's very uncomfortable, right? Like as a female, when your hair's falling out and you're growing hair and there's this whole emotional component to PCOS, and women with PCOS are also more likely to have something like anxiety, depression, and even disordered eating. So the last thing we want to be doing is saying, restrict this, don't eat this. Then we're just fueling the fire. And I often recommend, kind of to work through the PCOS journey to have a therapist or a mental health provider that can support you too, because it's a lot.
Right. It is. Yeah. Because like you said, because it can start young when you're going through puberty. Yes. So you're just kind of, you're growing up in that impression of, I need to lose weight, so I need to restrict myself.
Yes.
Food is not my friend. My body's working against me. And that just, pardon my French, but that's just a mind fuck from the very beginning.
It is. And I find when we go through a lot of health histories, it's been this, long-term relationship with food that's been really challenging. And I think for me as a provider, it's so hard to see certain things online of like, just eat this, just don't eat this, because it's so much more than that. And it can feed that story that you said is absolutely happening. And I love that we're talking about this because PCOS is multidimensional. There's a lot going on.
Yeah.
And there's a lot of providers that should be working together on it.
You're right. Well, I mean, just talking to you about this, I can see the value in, when you've been racing around trying this, Googling, which I do not ever criticize someone for looking up Dr. Google. I don't think that's a derogatory comment. That's people doing their due diligence and trying to inform themselves. but also just find after you've, looked around and informed yourself, there's such a relief of working with somebody and saying, okay, I'm going to work with you because I'm tired of stressing myself out and digging these shallow holes. That the thing about digging all the shallow holes, I'm going to dig a deep hole with guidance from someone who actually can tell me where it's going to be effective to put my work.
And it's so funny you say that, because 95% of the calls I get on, it's like, I've done all this digging. I'm overwhelmed. I just need support and like a clear path. And just releasing that anxiety is going to help your symptoms get better, because if
Oh my gosh,
about what to do, your blood sugar is going to skyrocket, your cortisol, right? All of these hormonal cascades are just going to heighten.
It's true. It's true. I mean, that's part of the beautiful placebo thing, is actually being in a good therapeutic relationship that's trusting, that so much of the healing actually comes just from that.
Yes.
It's an incredible value. It's so if people want to work with you, first of all, where do you show up? So we're going to have people who want to lurk and learn, or like, I just want to see what she puts out for free that I can learn from her. Where are you at?
Yeah, so the biggest thing is on YouTube. So Women's Nutrition Clinic YouTube channel. I have a new video that releases every single Friday. So if you subscribe, you'll be notified. And I'm happy to do a topic. If there's a topic that interests you, you can just leave a comment. But there is so much information on that YouTube channel. I don't think I could do more. I mean, I will, but you will get a lot of guidance on there. And then womensnutritionclinic.com. I have a full blog as well. I'm also on Instagram. So you can also just go to womensnutritionclinic.com, hit the resources tab, and it's going to bring you to all the freebies.
Okay. I just put that on the banner. I put it in the comments. I'm looking at, tell me your Instagram handle again.
Instagram is PCOS.dietitian. DITITIAN. I know some people spell it different.
I just put that in the comments. Good. So look, if you're watching this, look in the comments, IG PCOS.dietitian, and then her YouTube channel, Women's Nutrition Clinic. I just put that in the comments as well. So I hope you guys will lurk and learn and get to know her and get to know what she's doing. Because I know how it is. Sometimes you're like, that's it. She's my person. I'm calling her tomorrow. But I know there's a lot of you who just like to, kind of listen and feel her out and see what she has to offer. So binge on her videos and follow her on YouTube, and then check out her group programs and her one-on-one stuff, because I know, we've all had some kind of chronic and health thing. And, it's so nice when you find someone who knows your journey, who knows the situation inside and out, and can act as an experienced and knowledgeable guide.
Well, thank you so much for today and this time, and allowing me a platform to share. I really appreciate it.
Thank you. I think a lot of the people who I know and who follow these will really appreciate this. Yeah. Awesome. Thanks a lot, Eleni.
Yes.
All right. Well, thanks for listening, everybody. And thank you so much for joining me and talking today.
Of course.
All right. Bye-bye.
Bye.